Neonatal Withdrawal Syndrome. The most common cause of NAS is the use of opioids by mother during the pregnancy. What are the symptoms of neonatal withdrawal syndrome? And what options do we have here? What medications do we use to treat neonatal abstinence syndrome? Welcome, Dr. Anita Stola. Neonatal Withdrawal Syndrome. Neonatal Withdrawal Syndrome is also known as Neonatal Abstinence Syndrome. It occurs in newborns who were exposed to addictive substances while still in the womb, mom's womb. NAS is most often caused by when the woman takes drugs called opioids during pregnancy, but it can be caused by other substances like benzodiazepines, barbiturates, alcohol, and some antidepressants. The primary cause of NAS, neonatal abstinence syndrome, is the exposure of the fetus to addictive substances that the mother consumes during the pregnancy. Everything that mom consumes is received by the baby through the placental vessels, through the placenta. This exposure leads to the baby becoming dependent on these substances that mom is taking. After birth, the newborn no longer receives those drugs. When the baby is born, we cut the umbilical cord and those substances don't cross placenta anymore, leading to withdrawal symptoms. The severity and duration of NAS can vary based on the type of substance used, the frequency and quality of use, and the timing of the last dose before delivery. The most common cause of NAS is the use of opioids by mother during the pregnancy. When the pregnant mom uses drugs, these substances pass through the placenta and affect developing baby. Opioids such as heroin or methadone or prescription pain medication like oxycodone or hydrocodone are the most common culprits, but the other substances like benzodiazepines, so diazepam or lorazepam, barbiturates, and even some antidepressants like SSRI, Zoloft, can also cause neonatal abstinence syndrome. Some medications also prescribed for chronic pain, anxiety, or depression can lead to NAS if they are used during the pregnancy. This includes drugs like oxycodone, hydrocodone, clorazepam, and, as I mentioned, SSRI, Zoloft. The use of illegal drugs also, like heroin or cocaine during pregnancy, is a significant risk factor for neonatal abstinence syndrome. These substances can cause severe withdrawal symptoms in a newborn baby. What are the symptoms of neonatal withdrawal syndrome? Symptoms, first of all, appear within first 24 to 72 hours after birth, but can sometimes be delayed for up to 5 or even 7 days. When we cut the umbilical cord, the substance that mom was taking does not cross from mom to the baby system anymore, and the level of that substance in the baby's bloodstream gradually decreases, leading to the withdrawal symptoms. Severity of those symptoms depend on the type of substance the baby was exposed to and the duration of exposure. Prolonged exposure or use those drugs close to the time of delivery increases the risk and severity of withdrawal symptoms in newborns. What are the symptoms of neonatal abstinence syndrome, NAS? Systemic symptoms may include neurological symptoms, tremors, which is shaking or tremors. Those are very common in babies that are withdrawing. Sometimes in severe cases it may be also seizures. Then hypertonia, which is increased muscle tone or stiffness, and high-pitched crying. Those babies may exhibit excessive or high-pitched crying due to discomfort, and it's really hard to console them. Then gastrointestinal symptoms. Those babies are poor feeders. They have difficulties in sucking and swallowing. They want to feed, but they have very uncoordinated suck. Then diarrhea, frequent loose stools, and vomiting. So, some autonomic dysfunctions. Elevated body temperature and fever. Sweating is very common in those babies. Yawning and sneezing, as well as rapid breathing. Diagnosis of NAS typically involves a combination of maternal history of substance use, clinical observations of the newborn, and toxicology tests of the infant's urine, meconium, which is the first baby stool, and umbilical cord tissue. To assess and diagnose the condition, medical providers may use something that is called Finnegan scoring system, which is a detailed checklist of symptoms and their severity. In severe cases, babies may need to be treated in neonatal intensive care unit, NICU, neonatal ICU, and may require medication to control and gradually reduce withdrawal symptoms. Treatment of NAS involves supportive care to manage symptoms and to promote feeding and growth. The mentioned Finnegan Neonatal Abstinence Scoring System is a standardized tool that is used to assess the severity of withdrawal symptoms in a newborn with NAS. It was developed by Dr. Loretta Finnegan in 1970s, and it's widely used in the clinical settings to guide the treatment and management of infants experiencing withdrawal. Components of the Finnegan scoring system include a comprehensive list of signs and symptoms that are associated with withdrawal, each assigned a specific score based on severity. The system assesses about 21 symptoms across the various categories. An infant gets from 0 to 2 points for each of those symptoms. And now, what do we score for? Central nervous system disturbances, which is high-pitched cry. Then we score sleep duration after feeding. Is it less than 1 hour, or those babies sleep for 3 hours after they are being fed? Tremors, increased muscle tone, excoriation in the diaper area and diaper rash, then myoclonic jerks and jitterness. We score for some metabolic, vasomotor, and respiratory disturbances, which is sweating, elevated temperature and fever, frequent yawning, frequent sneezing, which is more than 3 to 4 times per interval, nasal stuffiness, as well as respiratory rate greater than 60 breaths per minute. Then we score also for some gastrointestinal symptoms like excessive sucking. As I mentioned, those babies, they want to eat, but they have very uncoordinated suck and they are not feeding well for that reason. Poor feeding, poor weight gain. Some babies with NAS need extra calories in order to help them grow because they have trouble feeding and they are growing slow. Vomiting, as well as loose stools, watery stools, and diarrhea. The Finnegan score is typically administered done every 3 to 4 hours. That correlates with feeding times. Each symptom is scored and the total score is summed up, calculated. Interpretation of those scores is as follows. 0 to 7, those are mild symptoms, and usually baby does not require any pharmacological treatment. Scores from 8 to 12, those we start to be concerned about. Those are moderate symptoms, and usually babies do require pharmacological intervention. And then score more than 12, those babies usually have very severe symptoms, and pharmacological treatment is necessary in those cases. How the Finnegan scoring system helps us clinicians? It helps us to determine the need for treatment. Infants with consistently high scores may need medication to manage withdrawal symptoms. Scores also guide the initiation and adjustments, so sometimes we have to go up on the dose, and weaning of pharmacological treatment. In severe cases, what does it mean? NAS scores greater than 8 for 3 consecutive scoring, on even one score greater than 12. In those cases, pharmacological treatment is necessary and is initiated. And what options do we have here? What medications do we use to treat neonatal abstinence syndrome? Morphine, often used as a first-line treatment for NAS. It helps to manage severe symptoms such as tremors, irritability, or even seizures. The medication is administered in a careful, controlled dosage based on infant's weight and symptom severity. The dose is gradually tapered over days to weeks, depending on infant response to treatment. If morphine is not enough and infant continues to have high scores, sometimes we have to use additional medication, phenobarbital. It's used as an adjunctive treatment when symptoms are not adequately controlled with morphine alone, and it's particularly useful for managing severe irritability and also seizures. Another medication, clonidine, it's an alpha-2 adrenergic agonist that can be used in combination with opioids to reduce withdrawal symptoms and decrease duration of pharmacological treatment. Besides pharmacological treatment, supportive care in NAS, it's very important, and supportive care includes swaddling, which is wrapping the baby snugly in the blanket to provide the baby comfort. Quiet environment, so keeping the baby's room environment calm, dark, quiet to reduce stimulation. And frequent feedings, offering small, frequent feedings to help with feeding difficulties and promote weight gain. During the treatment of NAS, your baby may be and probably will be fussy and hard to soothe. Doing these things can help to calm your baby. Number 1, room in with your baby. Mom and dad, room in with your baby. This means that you and your baby stay in the same room together at the hospital before you take the baby home. Number 2, give your baby skin-to-skin care. It's also called kangaroo care. This is when you put your baby dressed only in the diaper on your bare chest. Number 3, be gentle with your baby. Rock your baby gently. If she or he is sleeping, don't wake them up. Swaddle your baby. Wrap him or her in the snuggly blanket. Number 5, keep your baby's room quiet with the lights dim. And finally, number 6, breastfeed your baby. Feed your baby on demand. This means that you feed your baby when she or he is hungry. Give your baby binky, pacifier. Your baby providers will check on your baby often while you are in the NICU to make sure that she or he is getting better, having fewer and less severe withdrawal signs. Most babies with NAS who get treatment will get better in 5 to 30 days. Every baby is different. Your baby can go home from the hospital when she or he is feeding well, is sleeping well, is gaining weight, and has good NAS scores. So scores less than 8 without any medication, without morphine, phenobarbital, clonidine, for at least 48 hours after last of dose of medication is given. So less than 8 after medication is discontinued for subsequent 48 hours. What are long-term effects of neonatal withdrawal syndrome and exposure to narcotics and illicit drugs? The long-term outlook for infants with NAS varies. While many babies can recover completely, some may experience long-term developmental or behavioral issues necessitating ongoing medical and developmental monitoring. Babies with NAS may be at higher risk for developmental delays, including motor and cognitive impairments, behavioral issues, which is increased risk of behavioral problems such as, for example, attention deficit hyperactivity disorder, ADHD. Those babies often have growth issues, and some infants may experience growth delays or even failure to thrive. What can you do to prevent NAS in your baby? Here is what moms can do before delivery. If you are pregnant and you use any of drugs that can cause NAS, tell your provider, your OB doctor right away, but don't stop taking the drug without getting treatment for your provider first. Quitting suddenly, which is often called cold turkey, can cause severe problems for your baby, including death. If you need help to quit using these drugs, talk to your provider about treatment. Getting treatment can help you stop using drugs, and it's safer for your baby than getting no treatment at all. If you are pregnant and cannot stop using opioids without problems, ask your provider about medication-assisted treatment, also called MAT. NAS in babies may be easier to treat for babies whose moms get MAT during pregnancy. Medications used for MAT include most commonly methadone and sometimes buprenorphine. If you are pregnant and you go to a provider who prescribes medicine to treat a health condition, make sure that provider knows that you are pregnant. You may need to stop taking certain medications or change medication that is safer for your baby. Ask all your health providers if the medicine you take, even prescription drugs, can cause NAS in your baby. Even if you use a prescription drug exactly as your provider tells you to, it may cause NAS in your baby. And if you're pregnant or thinking about getting pregnant, tell your provider about any drugs or medicine that you take. Your provider can make sure that what you are taking is safe for your baby. She also can help you to get treatment for using street drugs or abusing prescription drugs if you need it. If you abuse prescription drugs, it means that you take more than has been prescribed for you, you take someone else's prescription drugs, or you get drug from someone without prescription. Now, what is important after baby is discharged? Baby with NAS treated for NAS is discharged from the hospital. After your baby gets home, take her or him to all of her follow-up visits and well baby checkups. even if he or she is doing well. Your provider checks your baby at these visits for problems that may be linked to NAS, like developmental delays and problems with motor and learning skills and behavior, problems with nutrition and growth, problems with hearing and vision, problems at home including harmful substances. This can include misusing prescription drugs and using illegal drugs. If your baby has developmental delays, talk to his provider about early intervention services. These services can help children from birth through 3 years old learn important skills. Services include therapy to help a child talk, walk, learn self-help skills, and interact with others. Getting services as early as possible can significantly improve your child's development. The CDC has information to help you to get early intervention services for your child and how to find services in your state or territory. At the end, key points about Neonatal Abstinence Syndrome, NAS. NAS happens when babies are exposed to drugs in the womb before birth. Babies can then be affected or go through drug withdrawal after birth. Symptoms of withdrawal may begin as soon as 24 to 48 hours after birth, or they may start as late as 5 to 7 days after birth. Some babies may need medication to treat severe withdrawal symptoms. The medication helps to relieve the discomfort and problems of withdrawal. NAS is potentially preventable problem, but it can only be prevented if the mother stops using drugs before pregnancy or as soon as she learns she is pregnant. In some cases, this is not possible to do it safely. In all cases, it needs close medical supervision. And if there is any questions, any concerns, any comments, please contact me at neonatologyforparents.com. Thank you.